In your morning medical news, Americans are rethinking that daily drink. A new CNN poll finds half of adults now view moderate drinking as unhealthy. That's up from just 25% in the early 2000s. The shift comes as health officials prepare to review alcohol guidelines. Current limits are 2 drinks for men, 1 for women per day. And NIH scientists now say a Trump White House communications pause is now affecting medical research. Sources inside the agency report they can't order basic supplies for clinical trials. That includes test tubes needed at the NIH hospital. The agency says essential requests will be reviewed daily. It's unclear if the administration intended the pause to impact research supplies. A program at the University of Nebraska Omaha is testing out innovative ways to help kids in need of prosthetics. Maria Cade reports on how their work is helping people in Omaha and around the world in a cost-effective way.
9-year-old Rue Gillespie uses a prosthetic on her left arm. As she's getting older, she needs a new one.
They're trying to make it fit.
That's where UNO's biomechanics department comes in. Rue first met the students and professors when she was 4 years old.
Research lab basically specializes in the development of artificial limbs for children. And we do that using additive manufacturing.
That's better known as 3D printing. Zunia says the prosthetics are cost-effective and easy to make in-house.
Typically, believe it or not, they range between $8,000 to $12,000 out of pocket. The ones we make here, is much lower. It's about $50.
About 60 families across Nebraska come to the school for the prosthetics. They also work with kids in other states and countries.
So they can fix, change things on the design. A lot of the materials we use are antimicrobial, recyclable polymers.
Data from the Amputee Coalition shows approximately 5.6 million people are living with limb loss or limb difference in the U.S. About 25,000 are kids.
Most of the children who have access to prosthetics when they're born without a part of their arm choose not to use them.
The team is also working on a project to better understand how they are assessing the patients who come in to get a prosthetic through nonverbal cues and actions.
When you meet them, sometimes they're going to be really able to communicate their needs, and sometimes they're going to be very shy. One of the things we're looking at is when we're not asking children to use the prosthetic specifically, are they still using it?
Fraser says she hopes the research will allow the team to improve the way kids, like Rue, are able to use their prosthetics.
Some of them help me ride my bike and some help me golf.
The research team is actively recruiting participants for the nonverbal cue study. And here closer to home, La Crosse's newest fitness center opening its doors to all abilities. The Star Center features specialized equipment and adaptive classes for people facing physical challenges. It is the area's first facility designed to make fitness accessible to all.
This is a health project. This is allowing people who have disabilities to invest in themselves and be physically active so that they don't have secondary health issues.
The new facility will officially open next month. We have membership details on our website.